My name is Dr Thomas Crabtree. I'm an ABCD Research Fellow working at the University Hospitals of Derby and Burton in the United Kingdom. Thank you today for listening to this ePoster presentation where we're looking at the real-world glycaemic outcomes associated with the Omnipod DASH system in the real world. These are some results from the Association of British Clinical Diabetologists Omnipod Worldwide Audit. These are our disclosures. The ABCD Worldwide Omnipod Audit launched in 2021 with the aim of capturing real-world routine clinical data on the use of this system in the United Kingdom and beyond. The aim, as with most of our audits, is to compare and contrast real-world outcomes to randomised control trial data to see that the findings from these studies translate into what we're seeing in clinical practice. We know that these environments are sometimes different, perhaps more poorly resourced, and also include individuals with more extreme baseline characteristics. What we know so far about the Omnipod DASH system is that it's a tubeless insulin pump option. Existing data shows no difference in outcomes between tubed and tubeless insulin pumps in a very recent study by Lala Leela-Raffner in Manchester. And there's a range of options and choice for people with diabetes. Having those choices is very important. The data that I'm presenting today includes data from 10 centres in the United Kingdom. Data was collected anonymously using a secure online and anonymous tool. The main outcomes that we'll be looking at today are HbA1c and total daily dose, but we'll also look a little bit at centre glucometrics. Individuals were included if they had available baseline and follow-up data, and statistics were assessed using paired t-tests. The results are on screen at the moment. I think the things to highlight here are that the Omnipod users in the audit have a long duration of diabetes. That's a mean duration of 21.7 years. In the United Kingdom, this system is only used for individuals with type 1 diabetes, so all of the users had type 1 diabetes at baseline, and 34% of users were new to pump therapy, so hadn't previously been on an alternative system. When we look across the population as a whole, there is a significant decrease in HbA1c on commencing Omnipod of minus 0.3%. But then when we separate this out into individuals who switched from alternative systems, they had no significant change. So those HbA1c levels that they were achieving were maintained. But in those who were pump naive, so this was their first insulin pump, the HbA1c reductions were greater at minus 0.5% between baseline and follow-up. We also saw a statistically significant change in the total daily dose, with a decrease in the total daily insulin dose once switching to Omnipod. The user feedback was great, so 96.5% of users would recommend this system to other people living with diabetes. And if we look at the time in range and time below range of follow-up in the naive group, we can see that individuals were achieving 56% time in range, so getting towards that 70% consensus target that we would obviously aim for, with a time below range of 3.2%. From the data that we have here, it seems that Omnipod DASH use is associated with reductions in HbA1c in individuals new to pump therapy. There's maintenance of HbA1c levels in those switching from different pump options. There's a reduction in insulin total daily dose requirements, and almost all would recommend Omnipod DASH to others. What this really highlights is that choice is going to be incredibly important, and what we want for our people with diabetes is a range of options to encourage the uptake of technology and not to limit people's choices, because we recognise the importance of being able to cater different individual needs. I'd like to thank all of the contributors to the ABCD audit programme. If you'd like to learn more about the audits or participate in this Omnipod audit, then you can scan the QR code on screen at the moment to learn more and to participate. I'm very happy to take any questions via email or during the conference. We also have a poster which you're welcome to come and view during our poster presentation session, and I look forward to hearing any thoughts and feedback. Thank you.